I am Kenneth Vandervoort. I'm an orthopedic surgeon here in Anniston, Alabama, part of Anniston Orthopedic Associates. I've been in practice here since 1987. I do general orthopedic surgery. I'm certified in sports medicine as well, but do trauma and general orthopedics and joint replacement, arthroscopic surgery. When a patient goes under anesthesia, many times they receive IV antibiotics before the surgery starts. And depending on which joint is being replaced, the patient's placed in a certain position. We do total knee replacement, total hip replacement, and total shoulder replacement here at RMC. And for a shoulder replacement, a patient's placed in a semi-sitting position. Knee replacement is done with the patient in a supine position or lying on their back. And most of the time the hip replacement is done with the patient rolled onto their side, with the side that's being operated on the up side. And after the patient's positioned, the area that's going to be operated on is painted with some type of antiseptic soap to create a sterile environment. Then there's what we call a draping phase, where we drape out the surgical field with sterile drapes. The operation starts and usually lasts between 45 minutes and an hour and a half. Most patients are not aware they're awake until they're already in recovery room after the surgery is done. With joint replacement, we're not removing large parts of the leg or the hip or the shoulder. It's a resurfacing procedure that only involves removing small amounts of bone in the quarter-inch range. After the surgery is completed, the wound is closed. Different surgeons have different techniques of closure. Many use metal clamps to close the skin, small staples or metal clamps. Sometimes sutures might be used and a bandage is placed. My contact information can be found at rmccares.org or through Anniston Orthopedic Associates.